Hi, Dr. Goldberg here, continuing our infectious disease lecture series. Today we're talking about the use of aminoglycosides. So we have a 20-year-old female presents to our emergency room with acute abdominal pain and peritonitis from a ruptured appendix. Other than surgery, we empirically place her on IV metronidazole or flagyl to cover anaerobes, and to cover gram-negative aerobes such as E. coli or Klebsiella. The choices included aminoglycoside and other meds, and we choose gentamicin since her renal function is good and she's not hypotensive. How do aminoglycosides work? They block protein synthesis at the 30S ribosome. We generally use IV gentamicin or IV tobramycin. IV tobramycin is less nephrotoxic, tends to have better activity against Pseudomonas. We dose aminoglycosides at 6 milligrams per kilogram daily. Generally, pharmacies keep an eye on dosing. We watch the kidney function on a regular basis to monitor for a rise in the serum creatinine. Amikacin is more commonly used in children, but certainly we watch for nephrotoxicity, especially in the elderly. Females, we also watch for ototoxicity. Bacterial resistance can occur with aminoglycosides. The three main mechanisms are reduced uptake, altered ribosome binding sites, and gene-induced enzyme modifiers. We use gentamicin topically, and it can be used orally as neomycin for especially in bowel surgery prep. Aminoglycosides can often be used in combination with a cell wall synthesis inhibitor in diseases like endocarditis. But primarily it's used in genitourinary infections and peritonitis or abdominal infections, and is best for gram-negative aerobes. Other agents that we'll discuss later that we can use for gram-negative aerobic infections include aztreonam, third and fourth generation cephalosporins, the penem agents like imipenem, doripenem, ertapenem, meropenem, as well as the extended spectrum beta-lactamase agents like piperacillin, tazobactam, ticarcillin, clavulenate, or ampicillin, sulbactam. And lastly, for gram-negative rod infections, we can use quinolone agents like levofloxacin or moxifloxacin or ciprofloxacin at times. So this is a nice summary of aminoglycosides. Hope this helps. Thanks, Dr. Goldberg, signing off.